Can you hear me? This is Richard. Can you hear me? Can you hear me yet? Not yet?
Hi, Richard. This is Erin.
Hi. I was just checking to see my audio was working.
Yeah, I can hear you.
So I don't have my my camera capability from where I am, so I can't be seen, unfortunately.
Okay, that's okay. Like I said, I think a lot of people will call in by phone only.
Okay.
Hi, everybody. Welcome. Hi, Janet. I see a few people have joined us. If you're looking for the right place, this is the UPLAN call on the Preschool Development Birth to 5 grant program, and we'll give a few minutes for people to join. Are others hearing like a echo, not echo, but kind of scratchiness when I'm talking?
No, it sounds fine for me.
Okay. Thanks everyone for waiting. I'm gonna give it a couple more minutes. Hi, welcome. You are in the right place for the UPLAN conference call on the Preschool Development Grant Program. We are just going to wait a few minutes for some others to join us. And you, again, are you guys hearing some scratching or echoing when I'm talking?
I don't.
Okay. Hi, welcome. If you've just joined us, we are getting ready to start the UPLAN call on the Preschool Development Birth to 5 grant program. So we're just waiting a couple more minutes for a few more people to join us. Hi, Norma. Hi, welcome. If you just joined us, we are going to get started, I think, with the UPLAN conference call on the Preschool Development Birth to 5 grant program. So my name is Erin Moore, and I'm the national organizer with UPLAN. So I'm going to start us off. Is anybody having any trouble hearing me?
No.
Okay. Okay, so we're gonna start with just some introductions so we can know who is in the space. So we are just gonna go around, say our name and our organization, where in the country you're located, and if you wanna share anything about what you're hoping to learn about the Preschool Development Birth to 5 grant program, you can. That's optional. So I'm gonna start us off while everyone's thinking. So like I said, my name is Erin Moore, and I'm the national organizer with UPLAN, United Parent Leaders Action Network. And I am hoping to learn what states are doing to engage parents in this program. I'm going to send us over to the Eastern time zone. And actually, Richard, I know you're in the Eastern time zone. Do you want to start and just do a quickly say who you are?
Sure. So my name is Richard Gonzalez. I work for the Department of Health and Human Services in the Office of Early Childhood. I'm going to be presenting to you on the grant. I'm responsible for the Preschool Development Grant Birth to 5, and I'll be talking to you about that and the role that parents play or can play or should play, and trying to answer your questions. I have a background that's in a teacher's assistant many years ago, and teacher in childcare, and I worked in Head Start, and I've worked at the city and state level as well. So I have a broad range of years of experience bringing to my work. So thank you.
Great, thank you, Richard. Is there anyone else in the Eastern time zone?
Institute. Hi, it's Melvette, and I'm calling on behalf of the National Parent Leadership Institute, and I'm in Danbury, Connecticut, and I'm excited to learn how states are engaging parents.
Erin, if you're talking, we can't hear you.
Oh, whoops. Thanks, Richard. Thank you, Melvette. Anyone else in the Eastern time zone? Okay, then let's go to the Central time zone.
Hi everyone, this is Janet Vargas with Kofi Power Pack in Chicago. And I'm here to learn as much as possible about what is included in the PDG grant and how it will impact not only our work, but just our parents across the state. Thanks.
Thank you.
Thank you. Anyone else in the Central time zone? Okay, let's go to the Mountain time zone. Anyone in Mountain time?
Hey there, this is Jennifer from Ole. Yeah, and I'm just here to learn more information.
Where did you say you were from?
And
I'm from Ole, Organizers Independent Development.
Jennifer, do you want to say where that's located for those who don't know?
Albuquerque, New Mexico.
Great, thank you, Jennifer.
And I'm Victoria, and I'm also with Ole in Albuquerque, New Mexico. And we're very excited to, learn all we can about this grant.
Great. Anyone else in Mountain Time?
Hi, yes, this is Erica Gallegos from Ole.
Hi, Erica, welcome.
Hi, Erin.
Okay. Then I think we have a lot of Pacific time zones, so I'm going to break it up a little bit. Let's go to the state of California. Anyone in California?
Hello, everyone. This is Rachel. I'm with Parent Voices statewide. I work in the Oakland, California office. And what I'm hoping to do is definitely hear what parent engagement looks like from the perspective of the grantors, and possibly offer any other suggestions that might strengthen parent engagement and parent voice.
Okay, thank you.
Thanks, Rachel. Anyone else in California?
This is Lou from Fresno, California. And I just want to learn more about the parent engagement and more about the program itself.
Great, thank you.
Hi, this is September Hill from Community Voices in Crystal Stairs in Los Angeles, and I'm just looking forward to hearing the information you're going to share on this call.
And what was your name again?
My name is September, like the month.
Thank you, September. Anyone else in California? Christelle, I think I had you muted by accident. Are you with us?
Yeah, I just got on.
Oh, sorry. Do you want to just quick introduce yourself?
Christelle, Parent Voices Sonoma in California.
Welcome. Okay, then let's move to the Pacific Northwest, Washington or Oregon. Is anyone with us?
I am. Can you guys hear me?
Yes.
Okay, so this is Joel. I'm the Washington State Parent Ambassadors Program out in the Seattle area. I'm glad you guys are doing this call. I'm really curious about how parents should be and can be engaged in the process. What the expectations are for the state.
Thanks, Joel.
What
Sure.
your name was? I'm sorry.
What was that, Richard? I couldn't hear.
I didn't quite get your name.
Oh, my name is Joel, and I work with the Parent Ambassadors program out in the state of Washington. We're attached to the Head Start Association.
Okay, great. Thanks.
Yep.
Hi, Joel. I'm sorry. I just missed.
Okay.
Anyone else in the Pacific Northwest? Norma, I think you're muted. Well, I'm not exactly, I know we have a few other Pacific Northwest folks on, but at least Norma, we see you even though we can't hear you. I'm not sure why we can't hear you, but I'm going to get us started. Is there anyone else who did not get to introduce themselves? Okay. Well, then I'm going to kick us off. So thank you all for taking the time to be with us today as UPLAN members learning about the Preschool Development Birth to 5 grant program. So as I believe everyone here knows, our vision as UPLAN is for parents to be at every table where decisions are being made that affect children and families, especially decisions related to policy or systems. So UPLAN's Policy Committee on Early Care and Education has been looking at several federal efforts related to child care and early education, including CCDBG, the Child Care and Development Block Grant, Head Start, and recently a federal program called the Preschool Development Birth to 5 Grant Program came onto our committee's radar, and parents on the committee said they didn't really know too much about this program and recommended that we host a call open to all UPLAN members to learn more about it. And Joel was lucky enough to connect us to Richard at the U.S. Department of Health and Human Services Administration of Children and Families. So our agenda for today is primarily, our goals for today, and you'll find these listed on the agenda that went out with the call. The goals are for UPLAN members to learn about the program and especially its parent engagement requirements across states, and to understand how that parents and parent leaders and parent-led organizations can engage with the Preschool Development Birth to 5 grant program in your states. So our agenda will spend the first chunk of time hearing from Richard about the program from his hat at the federal government level. And then we will open it up for questions from UPLAN members. And then toward the end of the call, we'll do a little bit of strategizing together about how, as UPLAN members, we can support parent leaders to be at the tables where the discussions about this grant are happening, and identify any next steps we want to take as UPLAN. Any questions or comments about the agenda? Okay, and I will just remind folks to mute yourselves if you're not talking so we don't have a lot of background noise, and I will mute you if you don't mute yourselves, which will be awkward because then I won't know to unmute you when you want to ask a question. So please mute yourself. And with that, I will turn it over to Richard to give us the kind of the big picture overview of the program.
Thank you, Erin, and thank you everybody else for joining. So I guess what I'm going to do is just start by clarifying. I got a couple of questions that have come in already, so I'm going to try to incorporate answers to those questions as I talk about the program. The first thing to know is that from the name, Preschool Development Grant Birth through 5, there's an intention here for programs to states to be looking at services that are from birth through age 5. So that means infants, toddlers, that means 3s and 4s, and even up to in 5-year-olds. The problem with the name Preschool Development Grant is that generally when we think of preschool, we think of it being for 4-year-olds. And in fact, the previous Preschool Development Grant was actually for 4-year-olds. It was to expand services in certain communities and states. This particular grant is not for direct services. This particular grant went to states who applied and got a passing score. So we have 46 grants that received an award, 46 states that received a grant award. And all of the states that are represented by your members have received awards. So everybody who is on this call is actually represented. And the purposes of this grant was really more of a planning grant. It's a 1-year grant, and states are supposed to do a comprehensive birth through 5 needs assessment within their state. Now, some programs do needs assessment. So Head Start does its own needs assessment, and home visiting does its own needs assessment. And there are other programs that do it to some extent. Maybe they do it only in the community, though. They don't do it statewide. And so this effort is for statewide. It's to look at all services and programs from 0 to 5, so that as future funding becomes available, states put together a strategic plan that will let them know where their priorities are and where to go after additional funding. So the first 2 activities are the needs assessment and then the strategic plan that's related to what they learn in their needs assessment. They have 3 other activities, and the third activity is very specifically pointed toward parents. So the activity is called Maximizing Parental Choice and Knowledge. And what that is about, we talk about the mixed delivery system. And what we mean when we're talking about a mixed delivery system is all the different ways that services are provided. So a state's mixed delivery system would be if the state has Head Start and childcare and pre-K and infant toddler care and special needs programs and home visiting. It's whatever the state has that serves children is part of their mixed delivery system. And it's called mixed delivery because it's coming from different grants and different programs. So the state has to think about ways it's going to maximize parent choice and parent knowledge and choice. And what that means is they have to make sure parents have enough information that they can make wise choices about where to place their children or where to get services for their children. And so the idea here is that whether the service comes from a family child care provider, or it comes from a classroom program, or it comes from the service systems, that they are supposed to be part of the planning. And the idea is to provide enough information about the variety of programs and services available to parents and their children from birth into kindergarten entry. The idea here also is supposed to particularly focus on families of low income and disadvantaged situations, but it's supposed to focus on all families, all children and families, and particularly in the transition points. So when a child transitions from toddler care to pre-K or Head Start, when the child transitions from Head Start or pre-K into kindergarten, how do we help support those transitions so that they're meaningful? So the state's got to write to activities that they would include that would get them closer to being able to enhance their parent choice and knowledge. The other thing they needed to do is focus on parent engagement. So basically, empower parents and programs so that they could facilitate that smooth transition between programs, and also describe how the parent education initiatives will target particular populations of parents. So including fathers, including parents who speak a different home language other than English, including families with children with identified special needs or other vulnerabilities. So the idea here is that the state needs to look at all of its services that support parents' education and various parent populations. So in effect, there should be no parent in the state that is not being planned for. There should be no situation in the state that's not being planned for. That's the big goal. Now, how do we get there, right? So the states had to write their applications, and as part of their applications, they had to talk about the variety of cultural and linguistically different populations they had in the state, the affordability and access of care, and just the different ways they provide care for children. That is the third activity, and we're going to come back to that because that's the main one that involves parents. The fourth activity has to do with sharing best practices, and this is across the programs. It's more for staff, but it could be for parents as well. It could be for programs. The idea here is every program creates its own resources and learns its own lessons, and we want to be able to share them so that if Head Start learns certain things, we want them to be able to share those resources with childcare and with pre-K and with infant toddler. And if infant toddler learns something, we want them to share it with early Head Start and home visiting and so on and so forth. So how does the state begin to identify all the different resources that exist, and then the best way to get those resources to everyone within the state that's focused on and working with populations that serve children birth to 5? And then the last activity has to do with improving overall quality. Now, it's a very general statement. It's a very general activity. It gives lots of flexibility to the states to define what that means. It could be coaching. It could be working with staff. It could be working with data. It could be working with other education for parents. It could be working with a lot of things. But the states cannot spend any money on those activities until they complete their needs assessment and their strategic plan. So they can work on maximizing parental choice and knowledge from the beginning. They can work on sharing best practices, but they can't work on the improving overall quality activities until they've done the needs assessment and strategic plan. That's because we don't want them spending money in the wrong areas. If they've done a needs assessment, they should be able to figure out then where the priorities are going to be and then spend the money, because the need is going to always be greater than the amount of money available to spend. And so some wise choices need to be made about where the money is going to be spent. Now, what does that have to do with parents? Well, first of all, what we did was we built in an expectation that this grant should not just focus on the programs that I mentioned: infant toddler care, family child care, center-based child care, home visiting, Head Start, early Head Start, pre-K. It should focus on the support services as well. So whether it's support services for children with special needs, early intervention, mental health consultation, health services, nutrition services, social services, what are all those services that support the family and make sure that the child has a successful development over the course of those various years? And so we built in an expectation that this grant is for improving systems. It's a systems grant, not a service grant, and improving relationships and improving collaboration and partnerships. So we said to the states, okay, in the past you've gotten money and you've included different stakeholders, but we want you to put out a broader net. Like, there are people that you have not included in the past that we'd like you to make sure you improve this time. So include people, make sure that there are parent stakeholders involved. Make sure that there are focus groups so you can hear from parents instead of just planning activities without those parent input about what they need and how to best get those services. Make sure that you actually are talking to parent associations. Talk to custodial parents as well as non-custodial parents. Talk to parent councils. Look at other representatives in the community. So they may not just be parents, they may be community partners or advocacy agencies or philanthropic organizations and businesses. So basically, who are all the programs and services that are going to be impacted by children and families? And let's try to make efforts to bring them to the table. Now, we know that in many cases that wasn't done to actually write the application. And that's partly because they only had 2 months and they wanted to make sure they got a good application in. But some states involved parent stakeholders. Some states involved many of the representatives of these various organizations in focus group discussions. And then they went ahead and wrote their applications. Other states did not do that, but they have an intent, or they wrote in their applications an intent to include parents and other stakeholders in their implementation planning. And so we're going to talk a little bit about how that gets done, or if that gets done. Now, every state governor had to designate the entity that was going to be responsible for receiving the funds. So the governor identified an entity, a lead agency, and that lead agency was the one that actually receives the grant funds and then gets to distribute them. Now, this is not for direct service, so we're not serving more children in classrooms at this point. We're not serving more children in homes, in family child care homes. There's no service to children in this particular one-year grant. This is a planning grant and a system building grant so that they can be better prepared to seek additional funding, having done all that planning up front. The idea then is that that particular grant will have a lead entity, lead office will have a lead person, a project manager, and at a later point in time, you're going to be getting information from Aaron on who those contacts are within the state, but we don't want to overwhelm them with multiple calls, so we want to make sure we talk to the states first and figure out an avenue for communication. So maybe they would identify a point person that you would speak to if you had questions or you had ways to communicate. And we'll come back to that in a minute. as you heard, this is not just pre-K, it's not just 4-year-olds, it's birth through 5. So we want to look at any and all programs that serve that age range. And it's concerned with part-time as well as full-time care. It's concerned with any type of care or service that's going to impact the child and their development. It includes children with special needs and the programs that operate for children with special needs. There's presently no funding for special needs children or services. Again, this is a system planning grant. But in theory, whatever they discover in their needs assessment will become part of the strategic plan, and the strategic plan will guide them on what they're going to search for funding for and how they're going to move forward over the next 3 to 5 years. There's an expectation for them to engage parents of all types, whether they be mothers and fathers, grandparents, foster parents, whoever is with the child and cares for the child, including other attendants who can be part of the responsibility of a child with special needs, for example. The idea here, again, is to look at ways to increase engagement of parents, but include them in the knowledge. So even if they're not in the actual planning sessions at certain times, that they benefit from the knowledge that gets generated from those sessions. And they learn more and more through websites and other resources that are available to them about the different programs and services that are available and how to access them. So the idea here then is that in addition to the programs I mentioned, they're also talking to other agencies. So you not only have HHS, Health and Human Services, and the Department of Education, but you have the Department of Substance Abuse Prevention, and you have CDC or the Disease Control Agency, and you have agencies that are working with disability services. You have all of them trying to collaborate together at the federal level and also at the state level. Now, so one of the expectations is that they will use this money to build relationships, to do more effective collaboration, and to look at ways to spend dollars more appropriately, so that if there are multiple programs spending dollars on the same thing, they can eliminate the duplication and spend money only once, but then share those resources or what they learn across all their programs. So that's the thinking of the grant. This is a 1-year grant. Then there will be another competition in August of this year, and there will be additional grants awarded in December that will be implementation grants. Now, this grant was awarded to 46 states as well, 44 states and the District of Columbia and the Virgin Islands. The next grant, unfortunately, will only be awarded to a smaller number of states. Less than half the states that got funded this time will get funded next time. And that's because the next stage is for implementation based on what they learned. So it takes a lot more dollars to implement. A certain percentage of those dollars can go to services. So the state, when it does its needs assessment and its strategic planning, will say, well, based on our needs money, here's what we think we need to use these federal dollars for, because there's other federal dollars we can apply for somewhere else, or we can talk to our state legislature about certain dollars, or maybe we can go to philanthropy and talk to them about certain dollars we need. But it will help them plan where and how to seek funding across the many opportunities that might exist. So even if a state doesn't get the next round of funding, they will still have plans in place that will allow them know how to pursue funding that becomes available over time, and how to influence conversations with their state legislators or county legislators, local legislators that are going to be making decisions about funding. Right now, states have received amounts of money that allow them to do what they thought they could do in 1 year. So the different amounts of money have been awarded to states. Anything as small as $575,000 and as large as 15 million, depending on what the state, where the state is in its development. So some states have already been working on needs assessments across the state and are farther along. There's some states that have not started that work yet, and so they need a large part of the time to do that work this year. So most of the emphasis this year is on the needs assessment, the strategic planning, and the maximizing parental choice and knowledge, and the sharing best practices. So now let's jump a minute to, well, what does that mean for you or anybody else who's not been part of the process? Now, part of what we're going to do at the federal level to try to encourage or increase involvement of people who are not involved is to do some check-ins with the states. And one of the first questions we have for the states are, tell us who your partners are. Tell us who you brought into focus groups. Tell us who your core strategy team is. We want to find out who's being included in the discussions, in the focus groups. Now, that may mean that you personally may not be involved, but hopefully there are parents being involved in one way or another. If you're not involved, but other parents are involved, we want to link you to them. But even if you're not involved, we want to look for ways to get you included. So one of the things we're trying to do now is I've asked Erin for contact information for you. I've told her I'm going to provide contact information to her of the people in the states who can be reached, and I will try to link people together so that you can talk to, if not the project manager, someone in the state who's working on the goal of maximizing parental choice and knowledge. And this way you can let them know what your role is, what your interest is, what you feel you can contribute, that you'd like to be involved in future communications, etc. In most cases, it's my experience that people aren't intentionally excluded, but that there's just so much to do. If people don't know who you are, they can't reach out to you. And also, or if they don't think you have anything to contribute, they don't reach out to you. So part of what we want to be able to do is explain to the states the role you play and how you can be helpful to them. And that's something that you would say to them as well. You bring a perspective that they don't have. And so you can share that perspective with them. So there'll be more information shared with Erin that she can then share with you. And there'll be information, hopefully, that I can share with the states. As I find out from states that people are not included, and that includes programs. So maybe, for example, they're including childcare and they're including Head Start, but they're not including the infant toddler programs. Then I want to make sure that they identify someone who's going to talk to those programs or be involved, represent those programs. So the idea at the federal level is to check who they're including and remind them who might be excluded. At the same time is to give you opportunities to get involved. Oh, you're going to be having parent focus groups around this topic in March? Let me make sure Erin knows about those parent focus groups so she can tell you guys to join that webinar and get on the call. So as much as we can, we're going to try to make those connections and assist the states in making those connections, or letting the states know who they can be talking to. So I'm going to stop for a moment. We're talking. I'm going to stop for a moment and see if people have questions or statements that they want to make, and I'm going to turn it back over to Erin so she can decide how she best wants to facilitate this.
Great. Thanks, Richard. So if you are on the Zoom platform and you want to put a question in the chat box, I will read them that way. And if you are not on Zoom or would prefer to just ask your question directly, we're a small enough group that people can just, I've unmuted everyone who I had muted while Richard was talking. So if you have muted yourself, just unmute yourself and ask a question. We're here to take advantage of the fact that we have Richard on the line to understand the information being shared about this program.
So there is already a question in the chat box. Unfortunately, I might need a little bit more clarity. The question is, please repeat the third point. I think you might mean the third activity, but if you don't, I'll wait for clarification. If you mean the third activity about maximizing knowledge, I can do that. If you mean something else, I would have to think about what my third was.
I have a question.
Okay.
This is Norma. How can parents get informed about federal program like this one? And my other question is, what is your agency doing to inform the parents?
So an agency perspective, from the federal perspective, I don't think we are personally or directly doing much to inform the parents, because I think we're pretty far removed from that. What we do, we try to talk to parents. Well, first of all, what we do is we try to talk to all the programs and all the associations so that they're aware of the information. So we try to get information out. But we don't usually have an avenue to talk directly to the parents most of the time, unless it's something like this kind of webinar. What we do, though, is what we try to do is we try to make sure that the states are speaking, or the grantees, if they're not states, like in the case of Head Start, where it's local agencies, we try to make sure that the Head Start program, which is obviously very well known for including parents, that model is shared with other programs within the state. So a lot of times, early Head Start are called upon to play a role, a facilitation role.
Thank you.
Haywood, did you want to say something? Because you're on mute if you did. I still can't hear you, Haywood.
No, I was talking to my daughter, sorry.
Oh, okay, sorry about that.
Hi, this is Rachel in California. I do have a question. I'm wondering, as you were talking about activity 3, maximizing parent knowledge and parent choice, I didn't hear any mention about what's called SFN, friend, family, or neighbor care. I mean, not everyone, wants a center-based or a Head Start kind of setting where there's, children as they're starting, and so there doesn't tend to be a lot of resources placed into that pot, or it's not often presented as an option. And so I'm just wondering, kind of at the federal level, I understand you said that it's the state's job to ensure that, that we are informed and made aware of these things, but kind of from where you're sitting, is family, friend, and neighbor even something that's being talked about?
That's an excellent question. And actually it is. So basically what we've said to the states, and there's certain things we can require based on the legislation that Congress puts in their laws. So this grant came through congressional authorization and provided the funding. And based on what they wrote in the legislation, we use that to do grants to the states. So there's certain things, those 5 activities I talked about, and I'm going to repeat the third one in a moment, but those 5 activities we talked about are part of the legislative required. And so we couldn't add a lot of other requirements, but we can do a lot of encouragement. And so to the point you made about family, friends, and neighbors, we said, okay, wait a minute now. We know that you're spending money on childcare and on home visiting and on Head Start because there's funds to do that. But there's not always funds for family, friend, and neighbor, and that's often community specific. And so what are you doing? When you look at the entire population, birth through 5, we're asking you to do an assessment of all services available to families. So that includes family, friends, and neighbor. Now, depending on what states' data they have and what systems they have in place, some states will have an easier time assessing that, and other states will have a more difficult time. But there's an expectation to look at that to the degree possible, and when it's not possible, to come up with strategies to make it possible in the future. So what data are they collecting? What data could they be collecting? How do they improve that data? The idea here is to absolutely look at any avenue, including, and a lot of that family, friends, and neighbor is the grandparents taking care of the kids, or uncles and aunts taking care of the kids when the parent's not available or is working or something of that nature. So there's a lot of things we want to look at in the state, and we're saying to the state, this is a good opportunity for you now to look at what you need to do to learn more. Maybe you don't have the answers yet, but maybe you could put a system in place that would allow you to evaluate that system, evaluate the family, friends, and neighbor approach that you have, and see how you could make improvements. So there is an expectation there, and there is some guidance available, but How they do it or whether they do it will be part of what we're looking at across the year. I want to go back to the third activity because someone asked for a clarification. So the third activity of maximizing parental choice and knowledge, this was very wide open. So the idea was it was very general, which means a state could think about doing this in a lot of different ways. Some states are putting up websites where where families can actually go to the website, put in a zip code or a community and say, here's where I live, what programs are in my community? And you can actually search the website and find the centers that are available or the services that are available in that community. Other centers are putting up websites that can't do that, but they say, here are resources on parenting or how to choose a good family provider or a good family friend neighbor provider until you can get into a program or some sort of thing like that. So there's lots of different resources that made available. States are looking at what do they presently have in place and how can they improve what they have in place so that more parents can access information and the information parents can access is of a higher quality and allows the parents to make better choices. And so different states, when you read the state applications, different states have described different ways to do that based on the realities in their state. Now, I haven't had a chance to actually read the applications yet myself, so I can't give specific examples. We had reviewers reread those applications so that we're not personally making the decision at the federal level. We have peer people from the states making decisions. Nobody makes decisions for their own state, but people who work in programs and support programs in states can review other state applications and score and rank them. And that's how grants get awarded. But ultimately, the idea here is for states to look at this. Now, some states, like California, for example, have regional policy councils. Every state has to have a state advisory council, a group of people on the state who represent different agencies and can help them advise the governor and advise the legislature on decisions that need to be made about early childhood. In states like California and Maryland, they have moved that state advisory council to regional policy councils or advisory councils. And so they have basically people in counties or in regions looking at their population, looking at the needs of their population, and then passing that information up. So that, a state like California is so huge, it couldn't possibly do it unless they did these regional focus areas. And so the needs of a particular community, like Oakland, is going to be different from Fresno or different from LA, et cetera, et cetera. In other states, while they may not have regional policy councils or groups of people, they still can and often do reach out to communities or cities and counties to ask for feedback to the process. And again, every state does it very differently, so it's hard to know how any particular state's going to do it. The entity or the lead agency was designated by the governor. In most cases, that lead agency was either a Health and Human Service agency or Department of Education agency, office agency. Not always, but in many cases, it was that. In some states, they even picked a non-state agency, like Mississippi, which I don't think you have anyone. Oh yeah, you do have Mississippi. Mississippi has actually its college board overseeing the work that it's going to do in Mississippi. So you have some states like Mississippi and Oklahoma that are doing other entities to support the work statewide. But most of the states, and I'm looking at the list of states right here, Texas is another one who has a group called the Texas Education Agency that's going to be the lead agency. The rest of the states, I believe the rest of the states except Mississippi and Texas all have state agencies that take the lead. But they have the requirement to coordinate across other state agencies and organizations. So the idea here is to get the information from communities, let the communities pass the information upward, the state pass the information downward, and then from the federal level, information is coming in as well. And hopefully through the coordination of all these pieces, you can make those decisions. Now, the names of the program managers and the agencies for each state, I'm going to send at a separate time. I'll send it to Erin so she can send it out to each of you as appropriate. I did not include that yet because I want to reach out to the program managers themselves and let them know who you are and who you should reach out to, because they may not be available as readily, but they might say, well, the best person to reach out to is the person who's in charge of task 3. And so they may give me a different person. So I want to get that information from the states, and then we'll get back to you and provide you with the names and contact information for those individuals.
Thanks, Richard. I'm watching our time, and I want to make sure people who may not have had a chance to comment or react or ask a question have time. We have a question in the chat box from Janet from Kofi Power Pack. It says, in Illinois, we have a new governor transitioning in. Should we expect the Illinois Preschool Development Birth to 5 grant plan implementation to change from the original because we just had this change in administration?
That's an excellent question, and it always happens, right? So one administration submits something, a new administration comes in. As a general rule, they cannot change the requirements of the grant. So they still got to do a needs assessment. They still have to do strategic planning. They still have to figure out ways they can maximize parental choice and knowledge. And they wrote to those ways in the application. So they're still supposed to do what they said they were going to do. They can change the individuals. So they can come in and say, you know what, this office is no longer going to be the lead entity, or this person is no longer going to be the project manager because I'm going to replace my leadership team. So they can do that. And they can put in requests to change some of what they wrote to, but only if it stays similar to what they wrote to. So they can't change the whole purpose. Like they can't say, well, we're not going to do anything around maximizing parental choice or knowledge, or we're not going to do anything on the needs assessment. They don't have those choices. They can't change that. That's what they got the funding for. So there is some flexibility, and sometimes state people who are in the states will say to me, well, I'm the point person for now, but I may not continue to be the point person if the governor changes who his leadership is going to be. So that can happen. We haven't heard that yet from Illinois, but it's possible.
Thank you.
While we're waiting for other questions, I would also like to ask, and I think you were going to ask this anyway, Erin, I'd like to ask, are any of you at all involved in this? Did you know about this before? Is this like, am I confirming information, or is all this brand new to you? If you were not involved, did you know of other people who were involved? It would be really interesting to know to what extent you might have known about this program.
Richard, can I comment on that?
Absolutely.
Yeah, so I think, so in our state, our Head Start collaboration office out in Washington has, I think, done a pretty good job of making sure that parents will be engaged in the process and actually putting some money in to support their participation. And so, but I am kind of wondering, have you guys had a chance in looking through all the applications? How are parents being asked to participate? Are there any states that have actually called out parents specifically? And what kind of levels of support have they at least wrote about in the grant? That's what I'm really curious about, and maybe other people can comment before you answer that. But
yeah,
I wonder if there's some kind of tracking mechanism. People really intentionally spoke to parents and being able to provide, because it's one thing about talking about involving people in advisory groups and design teams and all that kind of stuff, but actually having the resources to make sure parents can get there, whether it's childcare or gas money or whatever else, needs to happen. So I don't know who put that in their budget.
Yeah, so what I can say, I can't speak to any particular state because I haven't had a chance yet to read the applications because we've been doing all of the implementation and awarding and budgeting and so on.
Yeah.
But what I can tell you from the feedback I've gotten from reviewers and now from the federal staff that are going to be responsible communicating with the states, is that there are a number of states who asked, you know, can we use this funding for stipends to pay for childcare? Can we use this money for stipends to pay for transportation? Can we use this money for incentives to make sure parents show up at various meetings? Can we use this money for food to pay for lunchtime if we have a lunchtime or dinner meetings? So they have asked those questions and they've made requests within their budgets to use money for those purposes. Other than that general information, I don't yet have specific information about how they're doing that. They also wrote in their applications specific ways they intend to empower parents or ways to include in parents. But again, I don't have that firsthand information yet. We're starting to read the applications now and get to a better understanding of what they're each saying specifically. And as we meet with the parents on a regular basis, as we meet with the grantee on a monthly basis, we're asking them those kinds of questions so that we become better understanding of what it is they're doing. So I don't have that information yet, but it is the kind of question we need to get the answer to.
I wonder, this is a really quick follow-up to that, but I wonder if one thing that could be really useful is if, Richard, you guys or your staff could provide, you know, basically a generic letter maybe to Aaron that all of us could take to state agencies and say, look, at ACF, they expect parents to be involved and dollars can be used to support parent involvement. And just as a reminder, they may already know that, but it might be nice if we had some kind of documentation we could take with us to support our participation as a parent community. I don't know if you'd be willing to do that. That might be something that could be very helpful, though, and provide some clarity so they know that we know that they can provide stipends and other supports, and we can, you know, have some kind of documentation to support that when we meet with them.
And that's a great suggestion, and I see no reason why we couldn't do that. It's also my intent, as I mentioned, to introduce the program, the grantees to you representatives of the however many states, I forget, was it 12 or 13 states that you guys have?
There's 12 states across UPLAN. I'm not sure exactly how many are on the call today.
Right. So to make sure, though, that the 12 states know about you and who you are and what you do, and then have ways to get in touch with you as well, and that you have ways to get in touch with them. So I think both of those things can be done. The letter, certainly a letter can be given to Aaron to share with everybody and used.
Yeah, that'd be great.
Yeah, absolutely.
Thank you.
So one of the comments here for this person is you're confirming information. We heard about it at our CAPA and R&R Joint State Conference, which is great. But the state grant application has not been made available, nor information about which agencies, organizations are going to be involved. So two things. One, we have a really hard time making the state applications available. We want to do that at the federal level, but we have to go through a process where we make all of the applications, it's called 508 compliant, which means basically disability accessible. And we have to redact information, take out personal information that was in the grants that have people's personal information in it, that usually budget information and things of that nature. Unfortunately, we don't have staff to do those tasks, and so we're having a lot of difficulty getting it done. So what we're doing now is we're asking the states to post their applications on their websites and then to send us the link to the applications so that we can post the link on our website. And then we can share the website information with you through Aaron, and you could go on the website and hopefully find your state's application so that you could read it, and it would tell you the information about agencies and organizations that are going to be involved. So that's something we're working on right now. I actually hope to have that worked out by the end of the month so that that would be available at least for those states that are post their applications. And we're encouraging them all to do that as part of the expectation of transparency and collaboration. So, so hopefully that will get done soon.
Great, thank you.
I should clarify for you, in case when you do get a chance to look at the applications, the states were allowed to ask for the amount of money they wanted up to $15 million. But when we scored all the applications and we had 46 pass, that was a lot more money we would have needed than we actually had. So we had to cut back what we awarded the states. And so most of the states got only 71% of what they asked for. That's so that everybody could get an equal amount of funding, equal amount of opportunity for funding. So when you read the application reflects what they would do if they had 100% of the funding. They've now submitted a new budget narrative, a revised budget narrative that tells us what they're no longer going to do. In most cases, they scaled back. So if they were going to reach out to 10 communities, maybe right now they're only reaching out to 5. Or if they were going to develop something, they were going to develop 5 guidance documents, maybe they're only developing 2. So they cut back certain things that would be cost. In a few cases, they eliminated altogether because they thought, well, you know what? We'll have a better chance of doing that if we get funded in the next round, or we can go to our businesses, or we can go to our foundations and ask them for money to support that. I think we can get money to do that. So I just wanted you to know that, because there may be differences in what they said in their application versus now what they're able to do because they didn't get the 100% of the funding they asked for.
Thank you for that clarification. This is Erin. I'm being mindful of our time, so I am going to move us towards wrapping up. Does anyone have any last burning comments or questions before we close? Okay. Well, so to summarize the next steps that we just talked about, because I think UPLAN's goal with this call is really for this to be the catalyst, the beginning of supporting parents and parent-led organizations to be part of the processes that are happening at the states to look at childcare and early learning and birth to 5 systems. So as Richard said, I will be sending out a contact list for you all to know who to contact at your states. Bear with us. It might take a little bit of time, but as Richard described, the goal is for you all to be able to connect with people at the state level to ask some of these key questions about how parents are being brought into the process. And then that letter, Richard, that Joel recommended, we'll be following up on that to make sure that you all have some tools in your toolbox as you do this outreach to the grantees, to say that, you know, this is the part of the program that you're here to really talk about and learn more about and push on. And then I think I do want to also just say that UPLAN's policy committee on early care and education, which was the initial body that decided to do this call, is going to continue to strategize about how UPLAN can support our members to be at these tables, what we're learning from you all as you go forth and make some of these state level contacts, what this could mean for UPLAN engaging with this program longer term. So if you're not on that committee and you want to kind of be part of the follow-up to this conversation, please get in touch with me. And as UPLAN members, you're welcome to join that committee and continue to kind of debrief this and strategize and talk about next steps. So I think that's it. Is there anything else, Richard, you want to add?
Yeah, I just want to clarify that folks probably should not expect to be able to contact programs until March, which we're almost there. It's actually halfway through the month already. So, but it would probably be the beginning of March before you're actually able to do that. So I don't want you to have unrealistic expectations of what I can provide to you. So I know I'm already booked the rest of this week Next week, 3 days is 1 day is a holiday, and 3 days I'm at a conference. So I'm already running out of time. So I want to make sure that you know it will be coming, but probably not before the beginning of the next month.
Great. Thank you. All right. Well, I want to respect everyone's time, so I'm going to officially close our call. Thank you so much, Richard, for joining us, and thank you all the UPLAN members who took the time to be part of this conversation. Have a good day.
Questions, please send them to Erin and send them to me.
Thank you too.
All right, bye.
Bye, thank you.
Thank you.